Hi, my name is Dr. Jane Robertson, Director of Medical Affairs at IDEXX. Early diagnosis and accurate staging of chronic kidney disease, or CKD, is critical for determining appropriate treatment. The International Renal Interest Society, IRIS, recently updated their CKD guidelines to include the kidney biomarker SDMA, stating that SDMA may be a useful adjunct for both diagnosis and staging of CKD. Please refer to the video on IRIS staging guidelines to learn more about staging and the importance of monitoring with SDMA. This video will focus on the IRIS recommendations for treating CKD and how the IDEXX SDMA test can be helpful. As a reminder, SDMA is a stable molecule produced in all cells and is not impacted by lean body mass. By contrast, creatinine is a breakdown product of muscle, so creatinine concentrations can underestimate the degree of kidney dysfunction in patients with poor muscle mass. Therefore, as CKD progresses and pets lose weight and muscle, SDMA is often a more reliable indicator of disease progression and thus helps to guide treatment of CKD. Now that we can diagnose patients with as early as stage 1 CKD, let's talk about the IRIS treatment recommendations and how veterinarians can impact patient care in this early stage of disease. First, make sure that you investigate for and treat any underlying disease. Hopefully, this has already been addressed during the diagnostic phase of your workup, but it is important to consider periodically revisiting as well. For example, it has been shown that 30% of cats with CKD will develop a urinary tract infection. If this UTI develops into pyelonephritis, you may now have an acute on chronic episode to deal with. I think we can all agree this would be a problem best to avoid. As reviewed in our staging video, CKD should be substaged based on blood pressure and proteinuria. Treatment is recommended when the average systolic blood pressure is persistently greater than 160 millimeters of mercury, or if there's evidence of end organ damage, such as retinal arterial tortuosity, hemorrhages, or retinal detachment. First-line treatment for hypertension in cats is the calcium channel blocker amlodipine. Dogs are usually treated with an angiotensin-converting enzyme or ACE inhibitor alone or in combination with amlodipine. Persistent proteinuria, with urine protein to creatinine ratios greater than 0.5 in dogs or 0.4 in cats, should also be treated. Proteinuria is an indication to start a kidney therapeutic diet even in stage 1 CKD and to use an ACE inhibitor or angiotensin receptor blocker. Serum or plasma phosphorus concentrations should also be controlled because hyperphosphatemia can contribute to disease progression. Note that we are not just aiming to keep the phosphorus concentration within the reference interval, but lower than the upper end of most reference intervals, or less than 4.6 milligrams per deciliter. To achieve this target phosphorus concentration may require a diet change, for example, from a grocery store to a premium brand food or to a senior diet. The goal is to feed a food with lower mineral content and more bioavailable protein. In some cases, achieving this phosphorus target may be another indication to start a kidney therapeutic diet earlier. Phosphorus binders may be considered if dietary intervention alone is not effective. Potentially nephrotoxic drugs, such as NSAIDs for a dog with arthritis, should be used cautiously. If alternate therapies are not effective in this situation and NSAIDs are needed to improve quality of life, the pet should have its kidneys monitored more frequently at the very least. Pre-renal and post-renal abnormalities should be corrected as they arise. For example, if an older feline patient with stable IRIS stage 1 CKD presents with an acute episode of vomiting and anorexia, knowledge of the kidney disease will encourage the veterinarian and pet owner to treat the cat's dehydration more aggressively in order to help prevent an acute on chronic episode. Lastly, an easy treatment for stage 1 CKD, which also helps to prevent dehydration, is to make sure fresh water is available at all times. This is particularly important in cats that may prefer a variety of water sources, such as dripping taps, water fountains, ice cubes, etc. For IRIS CKD Stage 2, the treatment recommendations include all interventions for Stage 1, as well as the implementation of a kidney therapeutic diet for all dogs and cats. These diets have controlled amounts of protein and are phosphorus and sodium restricted. They are also supplemented with potassium, omega-3 fatty acids, antioxidants, and are alkalizing. Potassium wasting can be a problem for cats with CKD. If the renal therapeutic diet alone does not maintain serum or plasma potassium above 4 millimoles per liter, then potassium supplementation with either oral potassium gluconate or potassium citrate should be provided. If the alkalizing properties of the renal diet alone do not prevent metabolic acidosis, then the dog or cat should be treated with oral bicarbonate or potassium citrate. For IRIS CKD Stage 3, recommended treatment includes all therapies for Stage 1 and 2 with some additions. The target at this stage is to keep the phosphorus concentration below 5.0 milligrams per deciliter, which often requires the addition of phosphorus binders, in addition to the renal therapeutic diet. There are many effective phosphorus binders available, including aluminum hydroxide, lanthanum, and Selvamir. Caution should be used with calcium-containing phosphorus binders to avoid hypercalcemia and a resultant increase in the calcium-phosphorus product that can lead to tissue mineralization. Anemia should be treated based on clinical signs, which typically occur when the packed cell volume drops below 25% in dogs or 20% in cats. Management of anemia can include ruling out and treating a source of blood loss and consideration for treatment with darbepoetin, a synthetic form of erythropoietin, to stimulate red blood cell production. Treatment of nausea and vomiting with meropitant citrate or other antiemetics and the use of mirtazapine in cats to stimulate appetite should be considered when needed. Maintaining hydration becomes even more important with advanced CKD, and subcutaneous and oral enteral fluids should be considered. Encouraging the pet to drink is still the best way to provide fluids. Providing subcutaneous fluids to cats and small dogs with CKD is common practice. However, this can lead to hypernatremia and exacerbate hypertension. Additionally, there are no controlled clinical studies that have actually looked at the impact of subcutaneous fluids on quality of life or survival time. In dogs, evidence suggests that judicial use of calcitriol prolongs survival in Stage 3 when phosphate is controlled and ionized calcium and PTH are monitored. Note that a study done on cats with CKD did not show any significant positive impact of calcitriol. For IRIS CKD Stage 4, the recommended treatment again includes all therapies previously discussed. Now the target is to keep the phosphorus concentration below 6.0 milligrams per deciliter, which almost always requires phosphorus binders. Pets with advanced CKD typically lose weight as a result of decreased appetite. It is also challenging to maintain their hydration. Therefore, placement of a feeding tube, such as an esophagostomy tube, should be strongly considered to allow for nutritional and hydration support and to provide an easy route for medications. With this type of support, many pets with advanced CKD can actually thrive, gain weight, and enjoy more quality time with their owners. In closing, let's review the impact of the IDEXX SDMA test on IRIS staging and treatment recommendations. Recall that if a dog or cat is staged as IRIS Stage 2 based on creatinine, but the SDMA is greater than or equal to 25 micrograms per deciliter, then treatment for Stage 3 should be considered. Similarly, if a pet is staged as IRIS Stage 3 based on creatinine, but the SDMA is greater than or equal to 45 micrograms per deciliter, then treatment for Stage 4 should be considered. Therefore, SDMA should be monitored in patients with CKD to help best determine what treatments should be considered. For more information on diagnosis and staging of CKD, please watch the other short videos on the IRIS CKD guidelines.